There is limited application of pharmacologic treatment in uterine fibroids. This is due to the side effects such as bone loss and return of symptoms following stopping treatment. Why would someone use this treatment? So one reason is to help control severe bleeding, to reduce the size and correct anemia prior to surgery, and also to bridge to menopause, at which time the fibroids often decrease in size due to the change in hormone levels. Available treatment options. One of these is gonadotropin-releasing hormone agonists, according to Dye 2018. According to Valorin, Sanofi, and Declan 2017, the action of this medication, which is a synthetic version of luteinizing hormone-releasing hormone, is to inhibit production of gonadotropins. These medications, some examples of which are leuprolide or goserelin, are used for short-term preoperative treatment, and if used for longer than 6 months, should be used with add-back therapy. The patient taking this medication may initially experience flare-ups of the symptoms they are trying to treat, and then a reduction of menstrual blood flow. They may also experience symptoms similar to menopause, but those may be reduced with add-back therapy as well as bone loss. Add-back therapy includes administration of progesterone, estrogen, combined estrogen and progesterone, iproflavin, and raloxifene, according to Dye 2018. Raloxifene is an estrogen-like medication, and it has an effect similar to estrogen on the bone, which decreases their absorption of bone, according to Valorin, Sanofi, and Declan 2017. Another medication that can be used to treat uterine fibroids is gonadotropin-releasing hormone antagonists, such as ganirelix. According to Valorin, Sanofi, and Declan, the effect of this medication is reversible suppression of gonadotropin secretion. According to Dye 2018, we do not see the same flare-ups as we saw with gonadotropin-releasing hormone agonists, but there is a fast reduction of bleeding, but we still may see the menopause-like symptoms. Another medication option is selective progesterone receptor modulators, such as mifepristone and ulipristal. These antagonize the endometrial and myometrial effects of progesterone, according to Valorin, Sanofi, and Declan 2017. According to Dye 2018, these medications reduce bleeding and fibroid size with fewer vasoactive adverse effects and less of a negative effect on the bones. Some other treatment options are androgens or danazol, aromatase inhibitors such as letrozole, and selective estrogen receptor modulators such as raloxifene, which was mentioned previously. This medication mentioned above or previously, ulipristal acetate, is a newer medication, and according to Payesko 2018, it is a selective progesterone receptor modulator, which we talked about previously, and it blocks progesterone from feeding the fibroids, which results in them decreasing in size. It also significantly decreases uterine or vaginal bleeding.